Bismillahirrahmanirrahim. Fungal infections. Fungal infections introduction. What are fungi? Fungi are plant without chlorophyll. They are either saprophyte on dead organisms or parasites on living organisms. So they are previously they were regarded as members of the plant kingdom. Now they are considered as independent group, the kingdom of fungi. They lack chlorophyll and so unable to photosynthesize their own food from CO2 and water. They must exist as saprophytes on dead subjects or parasites on living subjects. The morphology: fungi are aerobic organisms that contain true nucleus, eukaryotic. The cytoplasm is enclosed by a rigid cell wall composed of cellulose and chitin. Their cell membrane contain ergosterol as the major sterol, which required for membrane integrity and fungal growth. No chlorophyll is present. As you can see in the figure, there is it's in eukaryotic nucleus, and there is the cytoplasmic membrane, which contains the ergosterol, and the rigid cell wall, which is formed of cellulose, polysaccharide, and polypeptide, and chitin. This is the morphology. According to the morphology, we can classify the fungi into three: unicellular, multicellular, and dimorphic. Unicellular, as yeast and yeast-like organisms, they are Candida and Pityrosporum mainly. They reproduce asexually by budding blastospores, and they have pseudohyphae, hyphae-like structures produced by elongation of buds. The multicellular, as the cellular units connect together from to form long filaments called hyphae, which are either septate or non-septate. Mycelium is a mass of hyphae that reproduce by spores, like dermatophytes and molds. The dimorphic are capable, under certain conditions, to undergo change from yeast to mycelial form, the Candida or Pityrosporum. So the unicellular and the dimorphic, like Candida and Pityrosporum. The multicellular, like dermatophytes and molds. Unicellular, they are yeast or yeast organism, and they reproduce asexually by budding spores, and they have pseudohyphae. The multicellular, they have multicellular units forming long filaments, hyphae, true hyphae, and they can make mycelium. They reproduce by spores. The dimorphic, they can change under certain conditions from the yeast form to mycelial form, like Candida and Pityrosporum. The reproduction: there are three types of spores, which are vegetative, asexual spores, and sexual spores. This is another differentiation according to reproduction. The vegetative spores, they arise following modification of a single vegetative cell or hyphae. You can see the figure. There is arthrospores and chlamydospores. The arthrospores, cells in the hyphae, develop thick wall and separate by disarticulation. Chlamydospores, a cell in the hyphae, become rounded and develop thick wall, either terminal or intercalary. So the first arthrospore, they make thick wall and separate by disarticulation. The chlamydospore, first they become rounded and then develop thick wall, either terminal or intercalary. Asexual spores, this is without nuclear fusion. They may be formed within special hyphae called sporophores, or born exogenously and called conidia. There is large conidia called macroconidia, which are three types: microsporum, trichophyton, and epidermophyton, and there is small spores are as microconidia. The asexual spores, most important are the conidia, which are the macroconidia, especially microsporum, trichophyton, and epidermophyton. And there is another type, which is the sexual spores, or the perfect state. This is the perfect stage. There is fusion of two nuclei followed by reduction division, meiosis. This is in contrast to animals, where meiosis occurs before the formation of sex cells, or gamete, and fusion. Fungi are often haploid and become diploid only at the time of nuclear fusion, the perfect state, which is short-lived. Depending upon the perfect state, it can be classified also into perfect and imperfect. The perfect, they are non-pathogenic except the piedra, And so the perfect, they have known sexual phase, they are non-pathogenic except Piadra, and the imperfect, not yet known, this include most of the pathogenic fungi. So here the sexual state or the spores or the perfect state, first there is the fusion of two nuclei followed by reduction, division, meiosis. There is perfect, which are mostly non-pathogenic except Piadra, and there is the imperfect, and which are the most of the pathogenic fungi. So now, according to the reproduction, there is the vegetative spores, which are either arthrospores or chlamydiospores, asexual spores, which are mostly conidia, macroconidia and microconidia, macroconidia, microspore, and trichophyton, epidermophyton, and there is the sexual state, or the perfect state, which are mostly non-pathogenic fungi. The pathogenic fungi can attack either skin and or mucous membrane, which forms the superficial mycosis, the dermatophyte and candida. So if they attack the dead keratinous structure like stratum corneum, hair shaft, and nail plate, they are only superficial mycosis, and they are the most important are dermatophytes and candida. Whether if they attack the internal organs or the systemic organs, this is the systemic or deep mycosis. This is the pathogenic fungi. Another classification. We will give a hint on the pathogenesis of fungal infections, the factors affecting the pathogenesis of fungal infection, and the defense mechanism of the fungus against the host factor. The pathogenesis of the fungal infection, it is affected to survival of the fungus on the skin of the host, and the physiochemical bond between the fungus and host cells, and skin surface factors, pH change, CO2 tension, release of proteolytic enzymes like keratinase and candida proteinase and Malassezia furfur lipase, which is responsible in the free fatty acid leading to irritation and folliculitis. Also, there is the host predisposing factors, which is important, like hydration, friction, humidity, and debilitating conditions like the diabetes, increased glycogen, and drugs like antibiotics, which decrease bacterial flora. So the pathogenesis of fungal infection, survival of fungal on the skin of the host, physiochemical bonds between the fungus and host cells, skin surface factors as pH and CO2 tension, release of proteolytic enzymes as keratinase, protease, and lipase, and the host predisposing factors as hydration, friction, humidity, and debilitating diseases as the diabetes leading to increased glycogen, and antibiotics leading to decreasing bacterial flora. The defense mechanisms of the fungus against the host factor: increased thickness of the cell wall, mannan like Candida and Trichophyton rubrum, inhibit the T cell blastogenesis, and deposition of melanin in the cell wall, like Cladosporum crenii. So there is the defense mechanism of the fungus against the host factor: increased thickness of the cell wall, mannan as Candida and Trichophyton rubrum, which leads to suppression of the immune system localized that inhibit T cell blastogenesis, and deposition of melanin in cell wall. There is the important classification of fungal infection. The fungal infection is either superficial fungal infection in the dead keratinized structures like stratum corneum, hair shaft, nail plate, or subcutaneous or deep. We'll finish the subcutaneous and deep now, which are the subcutaneous sporotrichosis and mycetoma, the deep or the systemic, like also sporotrichosis, and the blastomycosis, coccidioidomycosis, paracoccidioidomycosis, and others. This is the broad classification. We will talk about the superficial fungal infection, dead keratinized structures like stratum corneum, hair shaft, and nail plate. The superficial fungi are either dermatophytes, yeast, or molds. The dermatophytes, the tinnias, and the yeast like Candida and Petrosporum ovale, and the molds, which are saprophytes. Usually tinnias are asexual, vegetatives and spores. The yeast they produce by budding, and the griseofolvin is effective in the dermatophyte, the tinnias, and ineffective in yeast. And the types of dermatophytes, the most important classification is microsporum, trichophyton, and epidermophyton. So this is the broad classification of fungal infection. Superficial, on the dead keratinized structures, stratum corneum, hair shaft, and nail plate, like dermatophytes, yeast, and molds. And the subcutaneous, sporotrichosis and mycetoma. And the systemic, like sporotrichosis, blastomycosis, coccidioidomycosis and paracoccidioidomycosis, etc. We will discuss later. And now we will talk about dermatophytes, tinea. 3 types of classifications are there. Classification of dermatophytes according to the shape of macroconidia, which are 3 types: microsporum, trichophyton, and epidermophyton. Classification according to the ecology or source of infection, like anthropophilic, zoophilic, and geophilic. And classification according to the site of affection, either the keratinized epiderms like tinea fascial, tinea corporis, tinea cruris, tinea manus, tinea pedis, and or nails like onychomycosis and tinea angum, and of the hair like trichomycosis, dermatophyte folliculitis, Majuki granuloma, and tinea barbi and tinea capitis. So the classification of dermatophytes, which affects the dead keratinous structure like stratum corneum, hairs, and nails, or they called ringworm or tinnias, either according to the shape of macroconidia. There is 3 genera, which are microsporum, trichophyton, epidermophyton. Microphyton, it is spindle-shaped, thick-walled, rough-walled, 5 to 12 septa. Trichophyton, cylindrical, thin-walled, smooth-walled, and 4 to 6 septa. The epidermophyton are pear-shaped, thick-walled, smooth-walled, and 3 to 4 septa. Examples are of the microsporum, Microsporum odonii, Microsporum canis, Microsporum gypsum, and for Trichophyton, Trichophyton rubrum violaceus, and Trichophyton tonsurans, Trichophyton mentagrophytes, and Trichophyton verrucosum, and Trichophyton schonlenii. For the epidermophyton, there is Epidermophyton flocosum. This is the 3 types of macroconidia: microsporum, trichophyton, epidermophyton. Microsporum, spindle-shaped, thick-walled, rough-walled, 5 to 12 septa. Trichophyton, cylindrical, thin-walled, smooth-walled, 4 to 6 septa. Epidermophyton, pear-shaped, thick-walled, smooth-walled, and 3 to 4 septa. Examples are for Microsporum, Microsporum odonii, canis gypsum. Trichophyton rubrum violaceus, tonsurans, Trichophyton mentagrophytes and verrucosum, Trichophyton schonlenii, responsible for Favis, and Epidermophyton flocosum. And according to their ecology, source of infection, either anthropophilic or zoophilic and geophilic. The anthropophilic, it is from man to man, like Trichophyton violaceus, Trichophyton rubium, Trichophyton tonsurans, and Mycosporum odonii. Zoophilic, like from animal origin, like Microsporum canis and Trichophyton verrucosum and Trichophyton mentagrophytes. The geophilic, from soil origin to man, it is Mycosporum gypsum. So this is the anthropophilic from man to man, the zoophilic from animal origin to man, and geophilic from soil origin to man. Anthropophilic, Trichophyton violaceum, rubrum, tonsurans, and Microsporum odonii. The animal origin, Microsporum canis, Trichophyton verrucosum, and Trichophyton mentagrophytes. The soil from gypsum, Microsporum gypsum. And of course the classification according to the site we were talking about, either in the skin and nail, like Tinea fascial, corporis, crurus, manus, anguum for the nails, and onychomycosis, and for the hair trichomycosis like dermatophyte folliculitis, Majuki granuloma, Tinea barbae, and Tinea capitis. I want to give a hint of prevalent dermatophytes in Egypt: the Tinea capitis, Trichophyton violation, and Microsporum canis, and scaly ringworm. For the Favus, which is zoophilic, Trichophyton scholnii, and for the Carian, Trichophyton verrucosum and canis. And the Tinea corporis, also the mostly Trichophyton rubrum and violation, and the Tinea crurus, Trichophyton rubrum and Pterophyton verrucosum, and Tinea pedis, Trichophyton rubrum and mentagrophytes, and Tinea anguum, Trichophyton rubrum. Most of the Tineas are rubrum, Trichophyton rubrum, except the Tinea capitis, which has the violation and canis. And for the Carian and Favus, Trichophyton scholnii and verrucosum. Now we will talk about the laboratory diagnosis of the superficial fungal infection. There is a question of laboratory diagnosis and treatment of dermatophytes. This is the first part of it, which is the laboratory diagnosis, and we will discuss about the treatment later. Now the laboratory diagnosis of superficial fungal infection. There is first direct microscopic examination of hairs and scales by KOH, culture on Sabaro agar dextrose medium, and Wood's light examination. And another thing is the biopsy, of course, the histopathology by Bayes stain. First, we will talk about the direct microscopic examination, KOH, culture, fungal culture on Sabaro agar dextrose medium, and Wood's light examination and biopsy. For the microscopic examination, direct microscopic examination, first we make collection of material, which are cutaneous scales, hair and nail. The cutaneous scales by scrapings from the definite edge of the lesion with sterile scalpel. The hair, short broken hairs, should be plucked with forceps. The nail, the keratin under the edge, and do as deep as you can. And then specimens are best collected in folded slips of papers and stored for long periods without loss of viability. Also, there is swab from moist areas. So the collection of material, we can take cutaneous scale, hair and nail, and sometimes swabs from moist areas. The cutaneous scale is so the skin scrapings from the edge, the hair plucking, and the nail trimming and scraping from some subungual area. This is the collection of material. We make direct KOH examination by direct microscopic examination of hair and nails. Hair and scrapings of the stratum corneum obtained from the suspected area are mounted in 20% potassium hydroxide KOH on a glass slide and covered with a cover slip. The preparation is warmed gently and then left for 20 minutes. Before examining, dermatophytes are identified by presence of translucent, non-pigmented septate mycelium and arthrospores. So there is hyphae and spores. The candida show clusters of budding oval yeast. The candida is budding oval yeast, we will find, and pseudo hyphae. 1 drop of blue ink may be added in Petrie's versicolor examination to make it visible. There is also the dimethyl sulfoxide we can add as a softening agent to the KOH, mainly used to dissolve the nails. Also, there is a note of artifacts that happen: crystals, oil drops, threads, mosaic artifacts caused by lipid material between the keratinized cells, leading to irregular polygons. So the first direct microscopic examination of the hairs and scales by KOH, collection of the material by skin scraping, hair plucking, or nail trimming and scraping of subungual area. Direct microscopic examination using 20% potassium hydroxide, cover with a glass slide, wait for 20 minutes, and sometimes we warm it and to wait for 20 minutes. And then if we find septate, mycelium and hyphae and spores, this is dermatophytes. If we find candida, we can find budding oval yeast with pseudohyphae, and also we can add blue ink for the Petrus vesicolor examination. We can see here, this is the microscopic examination of skin scraping scales revealing septate branching hyphae. The second laboratory examination of the fungi is the culture. Culture on Sabaro agar medium containing glucose and peptone. At room temperature, identification of the fungus is based on macroscopic and microscopic appearance of the colonies. Bacterial contamination controlled by adding chloramphenicol 50 mg and saprophytic molds by chlorhexidine 0.5 gram. Now, the culture on Sabaro agar medium containing glucose and peptone, we can add chloramphenicol to inhibit the bacterial contamination, and we can add the chlorhexidine or hexamide to inhibit the saprophytic molds. The incubation type depends according, is it fast grower or slow grower? The fast grower, like Candida, Microsporum canis, it takes 2 to 3 days. The slow grower, like Trichophyton violacum and Trichophyton schonelanii, it is 14 days. So, the culture on Sabaro agar dextrose medium, we make the culture and we wait for either for fast grower 2 to 3 days, or for slow growers we wait for the 14 days. And this is the fungal culture. We depend on the colony morphology and the microscopic appearance. As we can see here, example of a colony morphology differences between different types of fungi and the microscopic appearance, and hence we make a diagnosis of the type of the fungus. This is the second laboratory diagnosis. The third one we will finish is the dermatopathology or the biopsy. Skin biopsy using PS stain. We find hyphae in stratum corneum. So there is we find normal skin, and when I look to the horny layer, I see some hyphae, so there is fungal infection stained by PAS. So this is the dermatopathology. The Woods light examination. Woods light examination is an ultraviolet filtered by Woods light glass, consists of barium silicate containing 9% nickel oxide, which transmits rays of wavelength of 365 nanometer. It is essential diagnosis and treatment control of epidemics of Tinea capitis. So the Microsporum canis and Odinii, brilliant green, Trichophyton schonelii, pale green, and others like Trichophyton violacum, sometimes they give no fluorescence. Hair infected must be living and growing, anagen phase. Sources of error, sometimes ointment containing petrolatum, reflection from the white coat, commensals in the skin like Petrosporum ovale. So the Woods light examination is an ultraviolet ray filtered with Woods light examination with Woods light glass that transmits rays of the wavelength above 365 nanometers. Essential of diagnosis of many diseases, and as fungal infection. The fungal infection actually that they give rise, now we will give fungal infection like Petrus versicolor, it gives golden green. Like scaly ringworm, green. Favus, Tinea capitis, bluish green. But regarding other diseases as bacterial diseases, erythrasma, it gives coral red appearance. And for the pigmentation, sometimes in melasma, in epidermal melasma, it increases it is increased, and in dermal melasma, it is not increased. In hypopigmentation, the hypopigmentation becomes whitener. So the Wood's light examination is an ultraviolet ray filtered by Wood's light glass, releasing or transmits rays of wavelength above 365 nanometer, essential for diagnosis of many diseases like fungal, bacterial, and some pigmentary disorders. Fungals, pityriasis versicolor, golden yellow, scaly ringworm, green, and favus, bluish green. And for bacterial infections like erythrasma coral red, the pigmentation, increased pigmentation as melasma, the epidermal increase, the dermal is not affected, the hypopigmentation becomes whitener. This is the laboratory diagnosis of the dermatophytes. We will talk about the host defense mechanism against fungi. There is non-immunological mechanisms and immunological mechanisms. The non-immunological mechanisms like epidermal integrity, epidermal turnover, saturated fatty acids from sebaceous glands, temperature, and competing organisms and co-pathogens. So the epidermal integrity, normal intact dry epidermis is resistant to dermatophyte infection. Trauma and moisture increase the susceptibility of fungal infection. Epidermal turnover, there is decreased incidence of fungal infection, psoriatic skin. Saturated free fatty acids in sebaceous glands, the acidic pH is not good for the fungus. So there, usually the tinea capitis is not affected the persons after puberty. Temperature, dermatophytes grow poorly at 37 degrees centigrade. Also competing flora, organism and co-pathogens is another factor, non-immunological factor. Second thing, in non-immunological factor, there is no non-specific mechanisms that prevent invasion of dermatophyte into derms, even in absence of immunity, like serum inhibitory factors as unsaturated transferrin and complement activation, and influx of polymorph nuclear leukocytes by complement activation, which inhibit and kill dermatophytes. Of course, there is increased candida of leukemic patient and in infancy. This is because there is decreased transferrin binding capacity. This leads to increased iron in which the fungus grows on. The H2O2 secreted by neutrophils also help in damaging the trichophyton rubrum infection. The immunological mechanisms, there is hormonal and cell-mediated immunity. The hormonal plays a minor role, the humoral, plays a minor role, humoral immunity, like immunoglobulin A, affected from the candida, affects the candida, but it has a minor role. But the cell-mediated, they are the important ones. Clearing the dermatophyte depends mainly on cell-mediated immunity. It's manifested by itching and papules and vesicles we can see clinically. Through sensitized T cells. Acute fungal infection are associated with local tissue reaction with various degrees of inflammation produced by activated lymphocytes and macrophages involved in delayed hypersensitivity reaction elicited by fungal antigens. There is also enhanced proliferation of skin in response to this inflammation that allows to get rid of fungal invasion. So there is delayed hypersensitivity reaction, cell-mediated immunity, and there is keratinocyte proliferation. There is a cell wall glycoprotein called mannan from trichophyton rubrum and also candida was observed to suppress cell-mediated immunity. It's inhibition of T cell blastogenesis and also keratinocyte proliferation. This factor may be responsible for chronicity and non-inflammatory presentation of some cases of trichophyton rubrum infections. Despite this immune deficiency, these persons have normal response to other infected agents and skin test antigens. It is a selective immune deficit. So the host defense mechanism against fungi, there are non-immunological mechanisms, either epidermal integrity, epidermal turnover, saturated fatty acids from sebaceous gland temperature, and competing organisms and co-pathogens, flora, and also like transferritine, unsaturated transferritine, and complement activation, polymorph nuclear leukocytes, and immunological mechanism, mainly cell-mediated immunity, delayed type hypersensitivity reaction with enhanced proliferation of skin. There is a note, of course, that persistent dermatophytosis have been noted in immunosuppressed patients, AIDS patients, and systemic steroid, Cushing syndrome, and atopics.